Are you suffering from a meniscus tear in your knee and you're wondering whether or not you'll need surgery? If you are, then hopefully this video will give you all the answers to your questions. Hi everybody, my name is Will Harlow and I'm the Over-Fifties Specialist Physio here at HT Physio in Farnham. And today I'm going to be talking about the 3 signs that usually tell us whether a meniscus injury will require surgery. Now, before we dive into the content of the video, if you haven't already, please like this video and subscribe to the channel using the link in the bottom right, because then you'll be the first to hear about our new knee pain and meniscus videos when they come out. Now that that's been said, let's talk about meniscus tears. Now, the meniscus is a structure that lives inside the knee joint. So if this is a knee joint, you've got your thigh bone here, the femur, you've got your shin bone here, the tibia, and you've got your kneecap here, the patella. And on the inside of your knee, we can see the inside when we move these parts aside, we've got this thing here, which is the meniscus. Okay, and the meniscus is like a layer of cartilage that sits between the tibia and the femur, and it acts as a shock absorber. So its job is very important. It stops shock from going up through the shin bone into the thigh bone. Now, the meniscus is very good at its job, so for most of our lives, it just sits there quite happily absorbing shock and allowing us to run and walk and move without too much bother. But as we get a little bit older, what happens is the meniscus, which has quite a high water content, it tends to dry out a little bit. And when it dries out a bit, it becomes more brittle. Now, the other problem with the meniscus is it's very tightly attached to the top of the tibia, the top of the shin bone, which means that when we twist with our knee, because it's so tightly attached, it hasn't really got much give to it. It doesn't have much room for maneuver. So if you couple together a dried out meniscus with a twisting movement, it's very, very common to get tears in the meniscus. So what a lot of people who come to see me about meniscus injuries report is they were out walking and then they just twisted the knee slightly. Maybe they slipped off a log or tripped over a stone and they felt a sudden pain on the inside of their knee typically. And that's often the start of a meniscus injury. Now, most people who have a meniscus tear tend to have pain on the joint line of the knee. Most people have it on the inside, although it is possible to have it on the outside. The inside is what we call the medial meniscus, and that happens to be the place that gets injured for about 80% of meniscus injuries. The other 20% it happens on the outside of the knee, which is the lateral meniscus. You can also have pain around the inside and the back of the knee and the outside and the back of the knee as well. That tends to be where the meniscus tears often happen. So the thing about meniscus tears is that for most people, they do get better on their own, provided you're doing all the right things. And I have another video about how to improve recovery from a meniscus tear on this channel. You can find that using the link below the video. However, they can take a very long time to get better, and not everyone's meniscus will get better on their own. And there are a few signs and symptoms we look for that determine whether or not someone might need surgery for their meniscus tear. So I'm going to give you the 3 main signs that I look for in the clinic when trying to advise someone as to whether physio is right or whether they need the attention from a surgeon. And then you can hopefully match those up to your own knee. So the first sign that someone with a meniscus tear might need surgery is that their knee is repeatedly giving way. Now, giving way is a horrible symptom when you're walking and suddenly the knee just gives out from underneath you. And sometimes this can be so severe that people actually fall to the floor. And giving way often happens for many, many knee injuries in the early stages of the injury. So if it's giving way in the first week and then it stops giving way, we tend to think of that as just a normal bodily response to the injury. And the giving way is happening because the muscles around the joint are temporarily shutting out. The brain is basically switching them off. Suddenly you've got no support, so the knee goes to give way. And if you're lucky, the brain will switch the muscles back on again so you can catch yourself. Obviously, in rare cases, people do fall when the muscles don't switch back on. But either way, it can be painful and it can be unpleasant. Now, if your knee is giving way and you've tried strengthening the muscles, you've tried physiotherapy, and no matter what you do, you keep giving way of the knee with your meniscus tear, that might be an indication that surgery is a good option for you. And the reason the knee giving way is happening more and more to you could be because the meniscus tear is quite bad and it keeps getting trapped between the two bones in the joint. And when that happens, the body or the brain recognizes a problem, it shuts the muscles down, and your knee gives way as a result. And for some people, if the tear remains and it's not healing, that giving way will keep happening. So that's one of the first signs we look for when we're trying to advise someone about surgery for a meniscus tear. Now, the second sign that surgery might be needed for a meniscus tear is mechanical locking. Now, mechanical locking is quite a rare symptom, but it's very pronounced when it happens. Basically, what it looks like is someone will have their knee that's mobile 1 minute and suddenly it will lock, okay? And they won't be able to bend it and they won't be able to straighten it. Now, typically with a locked knee, it happens when the knee is straight. And the reason it happens when the knee is straight is because that's when the two bony surfaces come close together. And the thing that's causing the locking is when the meniscus is trapped between the two bones. So again, the body recognizes a problem and it won't let you move that knee until the flap of the meniscus becomes free again. Sometimes locking can happen when the knee is bent and it gets stuck and you have to use your hands to manipulate it. That's another sign of locking. But what we don't look for as a sign of surgery is what we call pseudo-locking, which is where the knee just feels stiff. So often I'll ask people, does the knee lock? And they'll say, yeah, it feels locked up all the time. But then on closer questioning, it turns out that it's just stiff and it might catch a little bit. So that's not a sign of locking. Locking tends to be quite dramatic. And one of the key signs of locking is you almost always have to use your hands to manipulate the knee to get it moving again. So that's the second sign that you might need surgery, just to trim the part of the meniscus that's offending, get rid of it, and then the knee should be free to move. Now, the third sign that someone might need surgery with a meniscus tear is that it's been over 1 year and the problem is not showing any signs of getting better. Now, you might be thinking, do I have to wait a whole year to decide whether or not I need surgery? And the answer is, unfortunately, for many people, the case is yes. And that's because meniscus, even when they're doing well, they still take a very, very long time to get better. It's not uncommon for me to be treating someone for 3, 6, maybe even 9 months before they get a full recovery from their meniscus tear. And the reason they take such a long time to get better is because the blood supply inside the meniscus is very, very poor. Okay, so they don't have a direct blood vessel to the meniscus. The blood actually has to diffuse in through the bone, get to the meniscus, do its thing, and then diffuse back out again so it can heal. That's why it takes such a lot longer than if you'd say pulled a muscle or something. So it's not uncommon for the whole process to take 6 or 9 months, even if you're doing physio, even if you're doing the right things. So try not to get too frustrated with it. And if you've been suffering for over 12 months, you've had physio treatment and it's not improving, you might be a candidate to have it looked at by a surgeon. Now, one thing I would say is that there is unfortunately some evidence to show that people who have meniscus surgery tend to be at a higher risk of developing arthritis later in life in that same knee. And the reason is quite simple. Every time a surgeon has to go into your knee, they end up cutting through the membranes that surround the knee joint, and they're basically destabilizing the knee just a little bit. They're also taking away typically part of that shock absorber. So what happens when you've got less shock absorber? You're going to get more shock going through the knee. And what this does over time is very slowly chips away the cartilage and leads to a higher rate of wear and tear. So I would encourage you to try everything you can to avoid surgery if you have a meniscus tear, because the long-term outcomes are not absolutely fantastic. It will probably work really well in the short term, but for people who have surgery on their meniscus, we tend to see problems 5 or 10 years down the line. Anyway, I hope that's answered some of your questions. If it's been a useful video for you, please leave me a comment below. And if you want to get more information from me, similar things about knee health, meniscus health, ligament health in the knee, then do pick up a copy of my book. It's called Thriving Beyond 50 and it's got loads more advice about common knee injuries for over 50s. Anyway, I hope that's helped. Thank you so much for watching. I appreciate your time and I look forward to speaking to you on the next video.